Now to a story you will only see on CBS Mornings Plus. It's about a program helping thousands of doctors recover from substance abuse disorders. They're as vulnerable as anyone else, but unlike everyone else, they've got unique access to a program that allows them to continue seeing patients while also being in treatment for their own addictions. Happens to be one of the most successful rehab programs ever studied. Take a look.
How are you?
In the medical world, it's the patient's problems that generally command attention.
In your case, you had a very favorable tumor.
But for surgeon Courtney Barrows McEwen, a problem with alcohol dates back to at least her time as a star medical student.
In my mind, I was still I was successful, so like, how is this a problem?
Yeah.
But then, of course, it did become a problem later on.
Eventually, in fact, it landed her in the hospital. She was only allowed to continue practicing medicine and take on a prestigious surgery fellowship in Ohio if she quit drinking entirely.
You're supposed to be having zero.
Oh, 100%. Zero mind-altering substances.
And your career is on the line if you relapse.
Yes.
Which is exactly what happened. Though never drunk on the job, she says, test results that arrived while performing surgery back in 2021 revealed near daily drinking.
Your values go out the window and your judgment goes out the window, and it's all about just feeling better. And to me, that was the only way I knew how to make myself feel better.
When you get caught, how does it feel?
I just remember thinking in my mind, well, I better enjoy the rest of this case because I think it's going to be the last case I ever do.
But it was not, it turned out, the end of her career, as she was offered one last chance to get sober.
Physicians get sick like everybody else. They don't have any special protection or immunity from illness. They're special.
Dr. Chris Bundy is Chief Medical Officer for the Federation of State Physician Health Programs, which since the 1970s has been quietly working in nearly all 50 states to treat doctors diagnosed as substance abusers.
Why is a culture of silence a problem in the medical community?
Because the culture of silence means that doctors can get sick and bad things can happen to patients.
Right now, Bundy says there are more than 6,000 doctors across all fields of medicine licensed to see patients while also in treatment for their own addictions. And for anyone who might be troubled by that,
what do you say to those people?
I'd say a monitored physician is a safe doctor. If I walked into the doctor's office and it was one of my program participants, I'd breathe a sigh of relief.
Really?
Yeah, I would.
It may be one of the most successful rehab programs ever devised. According to one study, fewer than 20% of doctors who completed the program were found to have relapsed after 5 years, while relapse rates among the general public can be as high as 60%.
What is the secret to it? Why is it so much more effective than what the general population gets?
I think it's the comprehensiveness of it. So there's that wraparound chronic illness, chronic disease management model combined with the accountability of the program.
What you're describing sounds like something that should be available to everybody. Why isn't it?
Well, it's resource intensive. You know, what I just described to you doesn't come easy and it doesn't come inexpensively.
But the results have inspired other professions, including pilots, who we profiled in a 2017 story on CBS Sunday Morning.
So if not for the program, safe to say you wouldn't be a pilot today?
If it's not for the program, I certainly wouldn't be a pilot, but more importantly, I don't know if I'd be alive.
Which brings us back to McEwen, one of the few working doctors to ever talk publicly about her treatment.
So if not for the Physicians Health Program, where would you be today?
Probably dead, or at least I would say struggling.
Now 4 years sober, McEwen is a board-certified general surgeon in Columbia, Tennessee.
We'll need to give you some sort of treatment afterwards.
Yeah.
Which means, despite it all, she's back seeing patients. And, she says, better than ever.
What does it mean to be called doctor? Does the term have extra meaning now?
It has more meaning now because of, having gone through some of this stuff and also knowing that I'm a better surgeon, doctor, wife, daughter, sister you name it, than I ever was, even like before all of my addiction issues manifested. And so I'm sort of speaking to the me from 4 years ago and telling them it's been hard at times, but it's possible, and it's not insurmountable.
I'm really grateful to Courtney, to Dr. Barrows, for Dr. McEwen for opening up about this, because lots of people, including doctors, suffer from addiction issues, and rehab's results are usually very uncertain. Usually most people fail, and in this case, most people succeed.
And they succeed because?
This is the really tragic thing, right? Like, you got 50 million Americans out there with a substance abuse issue. Most are not in rehab, and of those who are, most relapse within a year. So it's failure on top of failure. These people don't have any like magical formula. It's the formula that everyone knows works. What's unique is that they have access to it. It's just acute care, so if you're in a rock bottom moment, then you have counseling. It could be in-house, could be you walk up weekly. And then you have monitoring. That's the key part. So if there's a relapse, you know you're going to be caught, and therefore you're not going to relapse if you know what you're going to lose as well. We should all have access to this. Pilots do, super successful. And if this were available to the general public, it would save so much money.
And that accountability is key. You're not policing yourself. You have someone who's partnering with you.
We all have something to lose. And in this case, it's their medical license. In our case, it might be any other job.
And doctors suffer from burnout at such high rates. I mean, I'm not surprised that this is an issue. Great story, Tony. Thank you so much.